Let's take a look now at challenges faced by healthcare workers in Gauteng. Members of the Young Nurses Indaba Trade Union are picketing outside the Gauteng Department of Health over the non-renewal of temporary nursing posts. The union says releasing the nurses and support staff hired during the pandemic will jeopardize an already fragile healthcare system. We are joined by Lerato Mthunzi, Secretary General of the Young Nurses Indaba Trade Union, who's taken a few moments to speak to us as the demonstration continues. Thank you very much for availing yourself this afternoon. So if we could start with just the purpose of this protest. Last week we heard from Gauteng Health officials who said they simply cannot afford any of this.
Thank you for having me in your show. It's very disappointing to hear such from the department that knew that the contract term would come to an end. It's just telling us that the department that we are dealing with has got no foresight. They are really sitting on the job. We knew that as we are going into the pandemic, shortages of staff was a real issue on the table. This fund or this grant that assisted them in aiding was not the and all. Our issues, we don't care whether the money is about the grant. It's not even about the COVID grant itself or the contracting of COVID-19 employees. It's the whole entire view of saying we need more hands on deck. We need more healthcare workers, nurses, doctors in the shop floor. Currently, we do not have. If you're taking away this 8,500 away from already a system that is limping, you are really going to plummet us again in a worse of crisis, a crisis worse than that of known as COVID-19.
A crisis worse than COVID-19. So without these nurses and support staff, just detail for us, because we heard some rather grim detail last week coming through in terms of services, in terms of food, for people at Baragwanath Hospital at least, and some other public hospitals. Without you being there, what does this mean for me and somebody else in South Africa who relies on these services?
The sad news that our citizens that we serve needs to note that even if we add or we save this 8,500 jobs, it will not address the entire crisis. It will only be a tip of an iceberg. We need an overhaul of ensuring that the staff acuities in our public hospitals are addressed, and they are addressed urgently. We have 4 groups that are currently targeted. Those who have completed community service that were trained with taxpayers' money, which are going to be let go. Those who were on this contract of COVID-19 who are going to be let go. EPWPs who are support staff that are so needed in our clinics that are going to be let go. And finally, the security guards that are never sure if they need to come back to work every month when they, after every payday, if that payday even comes. So the entire non-certainty and jobs that are not secured cannot go on. We just need the department to come to the party. Otherwise, it just tells us that the department is not fit to lead, and perhaps it's the issue of putting the department under administration must be looked at.
You point out historically South Africa used to have training colleges for nurses, and you also point out that now we only have 4 training colleges and that there is a shortage of staff. What do you perceive went wrong here and how to fix it?
The closure of colleges was the worst that the department could have done in the previous administration. But this current administration, it's even committing worse. Let me shock you. Every year, the 4 colleges can actually only train less than 50. By the end of the 3-year training session, we'll be sitting with maybe producing less than 20 nurses for the entire province. So that already paints you a picture that it's not only about closing down colleges in the past administrations. The current one is actually not even moving a finger to train adequate. So we've moved from training more than 1,000 per college, we are training 50. So the healthcare system currently is really not limping, it's not even in ICU, it's actually straight in mortuary.
You could very well go to another country and serve other citizens, but here you are, you're still in South Africa and you're championing this cause. Why is this so important to you?
It is exactly the debate that we have when we speak about NHI, that our mothers who fought for this freedom and our grandmothers continue to queue at 4, if not 3 a.m. in those clinics to be seen by these 3 nurses. And the total number of those people in the clinic is more than, it's thousands that are outside. There is no dignity. Yes, we have the freedom. This country, or the government of the day, the ANC government, has promised us as voters that we are going to sit and we are going to make sure that the healthcare system does improve. We are going to create jobs. And most importantly, we are going to give dignity to our citizens. We are unable to give quality healthcare to anyone. And we cannot just go away and solve a personal problem of a specific healthcare worker. This is a serious issue. In fact, we are saying this problem of shortage is a problem that actually the community and all organized groups in the community must join in and hold the department accountable.
Lerato Mthunzi, Secretary General of the Young Nurses Indaba Trade Union. But before we let you go, with your picket at the Gauteng Health Department offices there in Gauteng, what are you hoping will come out of that? Is there a memorandum that you have delivered? Has it been received?
Yes, we have already delivered a memorandum, and the memorandum was indeed received. And we are hoping that the ultimatum that we've given the Department of Health, which is 7 days, will be met, and we will take it from there. But we are adamant that if the response is there, but it's not satisfactory, we are going to intensify our efforts, and we are indeed going to be calling that this department must be put under administration.
And just to get clarity, you've given them 7 days to rehire the nurses?
We've given them 7 days to respond on the short-term plans that they can put in place. They're already promising that they are coming up with plans of absorbing the 50% of the total number. They will look into other efforts. We are just asking for more time.
And unfortunately, we've lost your connection, but thank you very much, Secretary General of the Young Nurses Indaba Trade Union, Lerato Mthunzi.